Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to News Extra. Tonight we are talking about thyroids, a butterfly-shaped gland in your neck just above your collarbone. Your thyroid makes hormones that control the rate of many activities in your body. What causes thyroid problems? What are the symptoms? Well, we've got Express Care's Dr. Jitka Lom here to tell us more about it. Thanks so much for coming in. So let's talk a little bit about, I mentioned what the thyroid is, but what causes thyroid problems?
Okay. Well, Mindy, as you mentioned, the thyroid controls metabolism, right? Sort of like the rate of your car speed. That's the thyroid, the accelerator. And there's kind of three things that can go wrong. First thing that can go wrong is that it kind of stops working. We call that hypothyroidism. You don't see anything. The neck looks normal. We find this out on a blood test. But the person slows down. So what happens? They gain weight, they're very tired, they lose some hair, their skin is very dry, they're constipated, their heart rate is slow, they only use the restroom once in a while. Everything's really slow, including their mind. So they can be pretty depressed. And an interesting thing is that they can develop high blood pressure as a result of this and high cholesterol. So these are all different things that can happen because your thyroid sort of gets tired and weak and stops working. Then there's the opposite, that's hyperthyroidism. And that's when the thyroid is overactive. And that can happen because you develop what's called a goiter, and that's just sort of basically an enlargement of the whole gland. And this is very common on Guam. Many people have this, and the most common disease that causes that is called Graves' disease. And so the whole thyroid will become very enlarged. The person will have all the opposite symptoms, feeling hot all the time, very anxious, jittery, sweating, heart rates very fast, blinking a lot, using the restroom a lot, all of those kind of symptoms, feeling very hot all the time, and losing weight. So this is another thing that can happen. And the third thing that can happen to your thyroid is that you can develop a lump on it. And the lump can be either a benign lump, meaning not cancer, just a piece of the thyroid gland that made itself into a lump, or it can be a cancerous tumor. And so if a lump is found on your thyroid gland, that needs to be checked, usually with a biopsy. And a small needle's placed into that, and then look at it under the microscope, find out what it is. So that's kind of an overview.
Okay, and so when somebody has problems with their thyroid, they would know based on the symptoms that you just discussed?
Well, if they either have a lump, in which case they might not have any symptoms at all, just a lump, or the symptoms of very slow metabolism or very high metabolism.
Okay, and so that goes into the next question, is why it's so hard for some people to lose weight when they have thyroid problems.
Yes, very difficult. So when somebody has hypothyroidism, either because they've had a surgery or because their thyroid on its own has stopped working, that usually is because of autoimmune disease, meaning your own body attacks the thyroid gland, it stops working, and then you're very, very slow on in all of these areas. And one of the areas is in fat burning, so it's hard for you to lose weight. And so if somebody they're not overeating and they have some of these other symptoms, then we usually check their thyroid gland to see. And it's very common, especially in women and in older people, to develop hypothyroidism.
Okay, and so what is the treatment if you find out that, okay, I've got either hyper or hypo?
Right.
Then what are the treatments out there?
Okay, so if you're hypothyroid, your thyroid gland is not making enough of that hormone, and so you can take it in pill form. And so that's very simple. You just start taking one pill a day, unfortunately for the rest of your life, but you will be able to be healthy and feel well and be back to normal. If you're hyperthyroid, there's more treatment that's required. Most of the time what happens is you're given actually a radioactive medication, radioactive iodine, that goes into your thyroid and destroys the whole thing, wipes it out. Then after that you have to get on medication to have some thyroid hormone. Other times surgery is required, but that's usually reserved for when people have a lump. If they have especially a cancerous lump, of course the thyroid has to be removed.
Okay, so it always requires medication then, and it can never go away once you have it?
Almost always, not always, because sometimes you can have two situations. One, if your thyroid is very overactive, it can actually just burn out on its own. and you can go back to normal, or maybe just a little hypothyroid and you need to take medication. Another thing that can happen is you can get sort of like a cold, a viral illness of your thyroid, where for a short time you go hyper, then you go hypo, and then you go back to normal. And that's again discovered through blood tests, specific blood tests that we look for to see if that's what's happening in your thyroid gland. And you can also have an ultrasound to see what does it look like under the scan. So almost always some treatment is required, at least temporarily, but sometimes you get lucky and you don't need anything.
Okay, and so one last question before we throw it a break is there any way to prevent getting problems with your thyroid?
Well, prevention is difficult in the case of the thyroid because it's related to a lot of different things, genetic things. Smoking is of course not good for anything. The other thing is exposure to radioactive materials. So if somebody's had some radiation for some reason, their thyroid can be disturbed. So when you're having an x-ray, a chest x-ray, or any other kind of radiation to your body, you can get a thyroid shield, and they'll put that on you before doing your x-ray.
Okay, good to know. Thank you so much. We are talking about the thyroid, and we will pick up this discussion after the break.